Hello, everyone, and welcome to Schmidtless Live. I am your host, Kurt Schmidt, president and partner at Foundry, and I am so excited for you to join me today because I've got an amazing person, an amazing story with an amazing platform. He's going to share all of his inside secrets with us today, well, maybe just some of them. But today we're going to be talking a lot about healthcare, building healthcare platforms, and what that means in the technology space. And the idea that starting with a lot of data, and why do we need data, right? We need data to make decisions. We need data to make great decisions, better decisions than we did before. The more data, hopefully, the better decisions we can make. And so we want to talk today specifically about some advice for people who are looking to either build in the healthcare area or they already are, and maybe just want to learn some tips and tricks from someone who's been very successful at it. So before I jump in, I do have to mention that we are hiring. Speaking of data, well, that's something we do a lot of. We're hiring a number of positions. So check out foundrymakes.com/careers and check out what we've got to offer. We would love to talk to you. And if you're not interested right now, it's okay. We'll talk to you soon. But if you got friends that want to chat, send them our way. I'd be more than happy to talk with them. All right, so I want to get over and introduce John. I got to set up his camera here, and let's add him in. There he is. Hey, John, how are you today?
Hey, Kurt, great. Thanks for having me on.
Yeah, thanks for being here. So tell me about Jump Technologies and the work that you do over there currently.
Sure. We are a cloud-based inventory management platform for hospitals. So our specific segment of the healthcare market is hospitals and health systems. And we help them manage the supplies that they use from the moment they land on the loading dock until the time that they are consumed by a patient. So the supplies that a hospital use is the second largest expense in the hospital after payroll. So there is a lot of stuff that flows through a hospital, as you can imagine, every day, and keeping track of it is a big financial component for them.
Yeah, and especially in the past year or so, right?
Yeah, well, they've learned not only is it a financial savings opportunity for them, but it's a life-saving opportunity for them. The last year has taught us what it's like when your supply chain goes afoul, and suddenly you can't have the gloves and the gowns and the masks that you need, and you are at risk as an employee, and the patients of your facility are at risk as well. So it's taken on a whole new dimension now in the post-COVID world.
Yeah. Well, let's start from the beginning, John. Growing up, I'm guessing it wasn't your plan to get into hospital inventory management software. Kind of how did Jump Technologies form? Where was the initial idea? How did it change over time? They say there's that luck is opportunity realized, right? So, when did you realize these opportunities, and how did that all happen?
Sure. The Jump Tech story is a very interesting story because where it started is nowhere where it's at today. The original founder of Jump Technologies had the idea of putting barcodes in newspapers and magazines linked to content down on the web. We would call those QR codes today.
Sure.
But in 1999, 2000, when he came up with that idea, a gentleman by the name of Reese Perry, he was way out ahead of his time. We didn't have the technology that we needed to be able to gather that data. I was coming out of a business that was a data analytics company for the retail industry that ended up going public, and IBM owns it. And so I was kind of looking for my next gig and was starting up another business when I came across Jump Tech, and I was fascinated at the way that they captured data. The whole concept of capturing data in a small barcode scanner about the size of the device used to unlock your car doors just really intrigued me. So I got involved with the business, but because we were so out ahead of its time, we had to morph the business into something that made more sense. So we became a order management platform for commodity consumable items. So office supplies was the big segment that we got into.
Okay.
And so we were partnered with Staples and Office Depot and Office Max, and eventually got into a whole bunch of other things. But one day I was on an airplane, and I had a scanner with me on the airplane, and the person sitting next to me said, "Okay, I'll bite. What the heck is that thing, and how does it work?" And it turns out he was a senior VP of marketing at Cardinal Health. a multi-billion-dollar distributor in the healthcare industry. And I told him the problems we were solving, and he said, John, we have all those same problems. We're distributing a commodity consumable item. So we'd like to take this into the healthcare space. And a few months later, I had a deal done with Cardinal Health to be our exclusive distributor into the healthcare space.
Yeah.
They private branded the product. They called it Order Connect and Part Connect. And they went and did healthcare. And we kept doing what we were doing in our lane and did that for the better part of 12 years. And then RFID technology really started to come around in the healthcare space. Yep. And we looked at that and said, for the majority of the items we're tracking, it didn't make sense. But Cardinal really wanted to go that path, so we parted ways. They went down a path that was more RFID focused, but suddenly they're like, John, here's all these healthcare customers that are now yours.
Yeah.
So we suddenly had to peek behind the iron curtain of healthcare supply chain, and we were shocked by what we saw.
I bet.
There really wasn't a lot of inventory management going on. There was just ordering going on.
A lot of paper being pushed around, I'm sure.
Paper being pushed around, and really 98% of what a hospital orders, the supply chain for a hospital is so strong with the distributors that are behind it. 98% of what they order, they get within 24 hours of placing that order. So when you get your materials that fast, managing them is the last thing you want to do. You really pay more attention to how you order them. And when you think about it, there's also the majority of the units of what they get costs less than $20. It's really inexpensive stuff that they go through really fast.
Right.
So, and nobody in supply chain gets yelled at for having too much inventory. They only get yelled at if they don't have enough, because the nurse went to the shelf and it's not there. So, but there was really a need to be able to reduce the amount of cash that was tied up on the shelf. So as we explored in inventory, so suddenly we had all these customers, so we just started talking to them. What are the advantages that you see in our product? How are you using it? Why don't you use your ERP system to do this? Mm-hmm. So we really kind of had to step back to square one of actually deciding if you're even going to start a business, right? So what is the problem that we're trying to solve? And again, for anybody thinking about doing this in the healthcare space, it's not any different than a lot of other companies, except in healthcare, you have two different paths that you can go down. Are you going to solve a problem to improve a patient's life? So are you going to develop a medical device? Are you going to develop a new medicine, a vaccine, what have you? Or are you going to focus on the operations of the hospital, like inventory management would do? Because those are two very different paths. Mm-hmm. One burdened with all kinds of approvals and regulations and everything that you need to go through, and one that's more operational without quite the heavy path going down that path. So if you're going to get into telemedicine, for example, which is one of the big trends going on right now, you're going to have a little bit more on the regulatory side that you need to deal with over there than you would if you were doing asset management. So we stepped back and said, let's figure out the problem that we're solving. And we learned that there was very little inventory management going on. And the reason it was it was very burdensome to scan barcodes. If you think about a nurse in and out of a supply closet, the last thing they want to do is try to find a barcode scanner to scan. And we found a big difference between what a nurse. So now we're trying to figure out who our customer is, right? Is our customer the nurse who's taking the supplies off the shelf, or is our customer the supply chain tech who's putting the supplies on the shelf? Mm-hmm. And we found this great divide between these two groups, and that the supply chain people thought they knew what goes on the shelf because they stock it every day, and the nurses know what goes on the shelf because they use it every day, and those numbers never matched.
No.
And there was a problem, and thus the need for data inside of the environment, so that we can have one set of numbers that everybody can agree to, and then we can actually start to manage inventory. So we went to a trade show after we kind of formulated our hypothesis of what it was going to work. Mm-hmm. Now, again, we already had an inventory management platform that we were using outside of healthcare. Yep. So a little bit easier for us in that we could take that platform to a healthcare trade show. And I mean, we didn't know anything about healthcare supply chain when we went there. All we knew is we had this process called Kanban, which again has been around inventory for 100 years. It was developed for the automotive industry by Toyota. but it wasn't being used in healthcare at the time. And so we said, well, in order to get data, we have to be able to capture it properly. And the whole theory of Kanban is someone goes and takes something out of a bin on a shelf, and when the bin's empty, they set the bin aside and put the next one forward. There's nothing to scan or anything like that. So we said, let's just deal with med surg supplies. So the gowns, the gloves, the PPE we've all heard so much about. So we narrowed our focus down to let's start there, because that's the stuff they're going through the fastest. And we will learn about healthcare supply chain while we do that. And so we went in, we solved that problem. We actually partnered with Mount Sinai Health System in New York. We went in and showed him our product, and he was like, that's got 70% of the functionality that I need. And I said, were you willing to work with us to get the other 30%? And they said yes. They were very innovative. And I will tell you one thing in healthcare, it's very hard to find the innovators that are out there. Healthcare is very risk adverse. You think about it in the healthcare world, if you take a chance on something and you're wrong, somebody could die.
Sure.
I mean, you're talking about patient health here. So they tend to find things that work really well for them and stay in that lane. So although we have innovation in a lot of things in healthcare, just look at what's happened with COVID vaccines in the last year.
Yeah.
There's been a lot of innovation around that. At the same point in time, there's more technology in Macy's to keep a black dress on the shelf in Macy's than there is to keep a gown on a nurse in a hospital today. And so we looked at supply chain and said, this is something that is desperately in need of innovation. The healthcare supply chain should be the leading supply chain in the country, in the world, because we just learned what happens when it breaks.
Right.
So, it's for us, we learned by dipping our toe in the water and doing some things. We had a platform that we could expand on, and now we are growing inside of the
so
hospital.
was it what I want to, a couple of things you said there, which I find people struggle with, which is that narrowing focus, right? So you're listening to the customer, and the customer is saying, and I think that's an interesting story you tell, because I've heard it told many times, but it goes a very different way, where the person says, it gets me 70% to where I want it to be. And so the product person instead just says, okay, give me a list of what you need, and I will just add those features, instead of what you had mentioned was, let's partner together to get it to that next level, versus this more transactional sort of thing of like, well, I just install it and then we'll let it run and see what we learn. I think it's really telling in the staying power that Jump has had is that partnership and that narrowing of focus in order to eventually build out stronger. And do you attribute that to part of the success?
For sure. I mean, it's you and I were just talking a little bit before the show. I mean, you can drown an opportunity.
Yeah, and boil the ocean.
Exactly, and especially in the software business, it's if you have enough money and I have enough time, we can do anything. And so really focusing in on what I'm doing working with this customer has to be something that's applicable to the industry, because otherwise I'll have a great solution for this customer, but I don't have something that I can sell across the industry. So being able to work with someone to partner with them and say, listen, I don't want you to look at this from just your hospital's perspective. I want you to look at this as how do we help reimagine the healthcare supply chain in general. Mm-hmm. And so, and then knowing how much you can take off. It's fascinating that we're talking today, because we are launching a brand new product today in our business, and it's a product that will evolve greatly over time. It's a product called Case Companion, targeted just at the ORs. And we had to sit down with the team and say, here's everything that we want to do. It's this huge thing that we want to accomplish. But if we try to bite that all off at one time, we'll die.
Yeah.
So let's figure out all the segments, and let's look at the value to the customer at every single one of those segments that we're doing. and put in place a roadmap that allows us to grow over time with our customers.
Yep.
And then we have development partners that we use. So we have hospitals who are development partners with us that come in and work with us on this new technology. And the development partners on Case Companion were nurses we were in the ORs doing workflow studies with them. And because if you don't make their job easier, your product's going to go nowhere.
Right,
you know?
right.
So it's really identifying who that customer is, identifying what their problem is. Is that problem a big enough problem that it warrants time to solve it? And what are the capabilities that they think they need in order to be able to knock it down? I mean, it's pretty basic stuff,
right.
but you can get lost in what's cool because
Yeah.
there's a lot of really cool things that I can think of that we can do. I just don't know that anybody would actually want to use them.
Right, whether they'll use them or not. And that's the thing where I hear a lot of founders talking is, again, back to, there's the famous quote that Henry Ford, right, if they would have asked them what they wanted, they would have said faster horses, right, which I don't think he actually said, but the meaning is that, you also have to come in with some expertise in that just inventory management and then applying it in there. So it is listening to them, but how do you bridge that gap of, like I think you kind of had touched on it about how they were stocking shelves and things, replacing bins and doing all that. Did your product eventually impact how this was manifesting in the physical space? Did it impact that? Did you have an impact not just on cataloging those things, but in those workflows just overall?
Absolutely. I mean, if you look at another customer, Ballot Health is another health system that's on our platform, and we put a Kanban system in there, and I mean, it was a drastic change in the workflows, the physical workflows inside of those rooms as to how they were doing things. They were doing something called par replenishment before, where they were counting, going into the room, if something looked low, count it, and report current inventory. Now they go into the room and just, if they see an empty bin, they scan it.
Mm-hmm.
And there is no counting. So their time in the room went way down. Their labor associated with it went way down. And the nurses all loved it because they just go take whatever they want out of the bin. Nobody was scanning any barcodes.
Nobody's
But
counting.
It was a physical change. Yeah, physical change to how they do things. And for us, we just wanted accurate data. Point of use technology in healthcare hasn't changed a whole lot. There's a ton of people out there that do Kanban. There's a ton of people out there that do perpetual inventories. Let's face it, inventory is inventory. There haven't been any revolutionary decisions that have come out of that in a long time. But a good example is our RFID quandary, right? When suddenly someone was asking us to do RFID, and I looked at the data and said, these are items that are so inexpensive and they use so much of it. Who's going to put all the RFID tags on everything? And the RFID technology is really expensive and it's really difficult to implement. So I'm not saying there's not a place for RFID in the hospital. There is on really expensive inventory, implants and the like.
Sure.
But for the bulk of what's in there, it didn't make any sense to us. And we had a pretty major partner putting a lot of pressure on us to do something with that. And, we just held back and said, I get why it's cool, but I don't get how someone would actually pay the money.
There's no value there.
Yeah. So,
yep.
So yeah, it's you often have a customer, the old Lee Iacocca thing, right? Your horse's example. Iacocca said, if I listened to my customers, I would have never invented the minivan, and that's what saved Chrysler. So
yep.
it's a delicate balance. And for this product that we're doing now, we actually hired a 12-year nursing veteran because we just didn't know enough about what went on inside the OR, and brought her in as a subject matter expert.
Mm-hmm.
We've got a guy that used to be the VP of supply chain at HCMC, who's our subject matter expert on supply chain inside of a hospital now. So we bring that expertise in-house because, at the end of the day, you really need to have some level of knowledge there that you can work.
People who have lived it, right? They've lived and breathed it. They've been drowned in it for years. You want that. Okay, so let's switch gears for a little bit. Let's talk about building the actual product. So something I talk to a lot of entrepreneurs about is team versus timing, right? So There's two sort of camps out there. There's some people who believe you can't have one without the other. But I just want to get your take, John. You mentioned, you had this movie moment on a plane where somebody's like, hey, why don't you bring that over here? And then, we go into a big montage of like money flying all over the place and John in private jets and stuff. But in reality, I'm guessing, you also, you couldn't take that opportunity back to a team that wasn't interested in this opportunity, right? Like if they were like, no, it's like Staple, like, why don't we just stick with Staples? Like, this doesn't make any sense. Talk to me about, building that team and how did that influence, or how did that affect the timing of everything that's been happening over the last 15 years?
Yeah, it's so the team obviously is vital, and getting the right people with the right mindset is crucial in many ways. We are the oldest startup that ever existed. When you take a look at some of the things that we do, and so you have to have a very entrepreneurial development organization, because you have to be fairly nimble in what you do. So you could go down to Rochester and hire a bunch of people out of IBM.
Yep.
But those people have very, very good, very deep, very stringent processes that they're used to going through in a product development component.
For sure.
Where on the entrepreneurial side, you're just going to go do something. I think the greatest example of this that's visible to everybody right now is what Elon Musk is doing at SpaceX. So, I took my team through the SpaceX story to really get them in alignment with and I won't go through the whole story, but if you look at what Musk is doing, NASA used to model everything, and everything was built on a computer before anything went to the launch pad. Yep. Because NASA hated it when stuff exploded. And Musk said, hey, we're going to build this can, and that's going to look a little bit like a starship, and we want to see if we can fly it up, move it over 150 meters, and put it back down again. And if we can do that, that's going to be a great success. And so he took his vision of the starship and said, well, let's just see if we can fly this can first. And when he flew the Falcon 9 Heavy, he went in and talked to his engineering team and said, we got to have this done by this date, or all of this bad stuff is going to happen. And his team said, it's not going to work. We're not going to do it. And he got a new team, and they got it done. Yep. So having a team with the mindset of how are we going to get this product to market as quickly as we can get it to market, and then innovate when we're there, is going to be the entrepreneurial way of doing things, as opposed to someone that's got this great big process that they want to go through. Yeah. I mean, I've had some hires in here over the years that said, well, we can't do that because we haven't done all the analysis that we need to do it. And I'm like, well, let's just go do it. We'll do the analysis, once we're out there.
Right. Yeah. Yeah, back to your risk adverse, right? You were talking about these hospitals and being risk adverse, and sometimes, and again, nothing against very senior talent, but I have seen very senior talent, they've gotten to that point because they've avoided a lot of cuts and bruises along the way, or they have tons of scars and they're like, no more risk for me. I've been beat up too much over the years. Sure. And so I want everything documented. I want a list I just want to be a ticket jockey. I'll just slide things over and get them done. Thank you very much. Versus, setting yourself up in a way to fail. And back to your point about the Musk story. Yeah, I read the book about the SpaceX story, and these crazy people sitting on an island shooting stuff off, trying to see if they can get stuff to work, and nothing was working for a long time. And the resilience those people must have had, and the vision, understanding what the vision was, and adopting it as their own vision, I think is huge. Back to your point about building the right team.
Mm-hmm. Well, yeah, and then here we're a business that needs to make money. We have investors here, and so there's a financial component to what we do. But this team really wants to fix the healthcare supply chain. And really wants to be able to be sitting back in their chair someday saying to their kids, yeah, this is innovation that we brought to the healthcare industry that saved lives, that made hospitals financially viable. Yep. And so you've got to get them engaged in the mission of what you're trying to accomplish. But then they also have to get engaged in that process. And as the CEO of this business, I need to understand in this fluid entrepreneurial space that we live in, I can't be saying, well, when are you going to get this done, and slapping them on the wrist if they don't meet their date, and or they meet a date but the functionality wasn't quite there that we wanted. You just need to be able to work with that and understand that and communicate that. And again, in the healthcare space, it's very hard because this new product that we're bringing to the market can increase hospital revenues by 30% just by cleaning up their charge capture. So they don't have to see any more patients, just capture more charges when they're there.
Yeah.
But yet you sit down and talk to a hospital and show them where they're having this problem. You can show it in their financial statements, and the first words out of their mouth will be, well, who else is doing this? And, well, you're the first one. We want to work with you. We want you to be a development partner. Oh, no.
Yeah, no.
Talk to me when you've got 10 hospitals using this thing.
Then come talk to me.
And so it can be difficult, but then when you find the good one, they're invaluable. But then you need to innovate. You need to show progress. You need to show things coming to the market, and you need to figure out what is. He called it Star Hopper, was the little can that he launched, and then SN1, SN8, and all the way up through. What does that progression look like? And quite honestly, for your development team, they love it because, everybody's really excited to release this chunk of functionality that we're releasing.
Yeah.
And but it's not the whole thing yet. There's still more to come. But what we're delivering is significant. But our vision for where we want to get with this is something that's got everybody really energized. And having those little victories along the way is good for your dev team because they get to stand up and be proud of something that they delivered, and it's good for your customer because you're solving a problem for them, and yet they're really excited about what you're going to do next.
Yeah.
So it can be. I love the entrepreneurial stage of a business because it's all for one for all. What do we need to do? Where when you get bigger and now you've got 50 or 60 developers, now you got to have all the process around that and everything else, and it becomes a little less entrepreneurial. So this stage of the business is a lot of fun.
Well, and the idea of being able to bring those innovations and those technologies into a space like that, it just seems really exciting. On the surface, if you look at it and you're like, well, it's inventory management, it doesn't sound like super sexy, but in the way that the actual impact that it has, I think can be so attractive to a team when they really understand what that impact is. And that's what I see in a number of spaces, is that if the team doesn't understand the impact that their work has or isn't exposed to it, it's going to be really hard for them to take ownership of that. And again, I hate to rant here, but since engineers make so many decisions in the micro while they're there coding and building things, if they don't understand why those decisions, why they're making those decisions, they're not going to always make great decisions when they're making those micro adjustments over time. And people wonder why, you get crazy software that either takes way too long or doesn't work as well as it should, or in order to make a change, you have to refactor 1/3 of the platform.
Yeah, well, and it's why product management, even though in a small entrepreneurial company, you may not have a product manager, someone is serving as the vision for that product. And that person really needs to make sure that things don't get overcomplicated, that we're not chasing edge cases somewhere in the development of our product, that we're putting all of these additional clicks and taps in something so that we can get to this one edge case. You just look at it and say, if that edge case happens, it's going to happen, and this is going to be the workaround to get around it.
Yep.
And so it's very important that you sit and look at stay focused on the big problem that you're trying to fix, get that fixed, and then one of your other releases can be to get out a little bit more towards some of those edge cases.
Yeah.
But at the same point in time, keeping your software as simple as you can possibly keep it. I mean, when we developed the Kanban system, and again, it's been around forever, but our focus was, let's not fool a PAR system. So PAR system, I scan it as I take it off the shelf. Everybody
Yeah.
had those. Very few people had Kanbans. We had one before we had a Kanban. And I said, well, all I have to do is go scan that and report current inventory at 0, and it'll generate an order to replenish it. Well, that created problems like you can't have the same item number existing in the same location twice. So we just said, if we're going to build Kanban, let's build a true Kanban that is as simple to use as it can possibly be so that people will actually use it. So we could have taken the shortcut and fooled with our PAR system and made it more difficult to use, but we would have got it to market much faster.
Mm-hmm.
Or we could say, if we really want people to use this, let's build it the way it should be built. Let's take a little bit of extra time to build it right. And we're one of the few pure Kanban plays out there. And if I'm in a competitive situation, I just say, how many things do you got to do in order to generate that order off of that competing system versus my system? And we win that every single time.
Every time, yeah. So the last thing I want to ask you about is that sales side of things. So I think, we've got a great idea. You mentioned the healthcare system is risk adverse. So it's really hard to just walk in. And even like you said, even walking in and saying, I can save you 30% year over year in costs is still sometimes not attractive enough to get that first over the edge. What I heard from some of your origin story, if you will, is getting those champions early sounds like something that has been really beneficial for you, is getting those internal champions to kind of help pave the way for you. Would you say that's part of the success that you've, or what else would you contribute to that?
So early champions is vital. Understanding that no one person in a hospital makes a decision. So when you're in the sales process, you're in a committee. And so we know at a minimum, we are the CIO, the CFO, the VP of supply chain, probably the CNO. And if you have 5 or 6 people that you are aware of in that buy team, they're talking to 5 or 6 other people that are influencing it that you're not even talking to.
Yeah.
So
right. There's a social and social political sort of nature to that.
Especially in healthcare. Healthcare is a little mini government being run because most of their funding comes from the government. Medicare and Medicaid pays a lot of their bills.
Yep.
So the everything is done by committee. Nobody's going to go off on their own and do something, but finding that champion that can take you through that is important. And then finding, in my case, you have to have an innovative CIO at the hospital who's willing, because that person, I'm a bolt on to an ERP and an EMR. So I'm another integration that he's going to have to do or she's going to have to do. So you have to find someone that says, you know what, the solution that I have in place as a CIO right now isn't good enough, so I'm going to bolt this on. They've got to be innovative thinking. And then for the bulk of what we have done in the past, it's been the supply chain, VP of supply chain. So you have to have an innovative thinker there. Now that we're in the OR suite, it's the champions in the OR. It's the CNO, CMO. And then the other thing is understand how that group buys. What is changing today is the days when you sit with your Rolodex and your phone and it's all about the relationship. That's not the way people are buying anymore. They are going online and finding their information there. So they're
doing their own research.
And so you have to create this information ecosystem for them to be able to tap into, because they would rather read it than be able to listen to me tell it to them. And then they want to validate it somewhere.
They don't need you to come in and do a hour-long presentation and pitch. They're showing up more educated than they were 10 years ago, I'm guessing.
Absolutely. So your salesperson needs to be someone who can manage that process to make sure that you've got all the information there that you need to have, that it's timely and accurate, and can make sure they're pointing those people in the right directions. That's more important today than the guy who's building that big relationship, which is the way I'm 59 years old. That's how I learned to sell, is you create a relationship with the customer. That's changing drastically right now. So the type of salespeople you hire is even different. But yeah, it's and then that innovator who's worked with you, they need to realize, and you need to almost put this in your contract, that they need to be the reference for you to validate. So you're going to write a case study. The most important thing you can do around a medical product that you are going to push is to have a very solid case study.
Showing other people's success.
And it can't say that Jump Tech is a great company with great people. It needs to be, here is the value that this software brought to the business, brought to the hospital. And getting that reference can be very difficult to do out of the healthcare industry, because they never like to talk about anything that they're doing wrong.
Yeah.
And if you think about a reference story, here's everything we were doing wrong, and then we fixed it with Jump.
Yeah, we do work in the healthcare field, and it's very difficult to get somebody to go on record saying what a difference this software we built for them made.
Yeah. So that validation point is really important. And so when someone's going to enter into a development partner relationship with us, they get all kinds of financial incentives and everything else to do that.
Mm-hmm.
And the most important thing that is written in our contract that we get out of that is that they have to be willing to be a reference and show up in your podcast someday or what have you.
Yeah.
So that it validates all of the data that they are seeing when they're looking at the information that we're putting out.
That's smart, John. I love it. Okay. I could talk to you all day, John, but I know that you're a busy guy. You've got a lot going on. Tell me, if I want to know more about Jump Tech, this new product that you got, that you launched today. Congratulations on that, by the way. Where do I go? Where do I find out more info? How can I get into contact with you?
So jumptech.com, jumptech.com is the website. Feel free to go there. Sales@jumptech.com will get you into our sales visibility, and then the phone number is 651-287-6000. Feel free to reach out and give us a call. Love to talk with you.
Awesome. Thanks for taking the time out of your day, John. I really appreciate it.
Kurt, thanks for having me on. I always enjoy talking with you.
Thank you. I appreciate you. All right, everyone. So that was John. Go check out jumptech.com. I will have links to all the things in the show notes and all the places where it needs to be. As mentioned before, we are hiring. Go tell a friend, tell two, tell three, tell a gaggle of folks. Tell them. I want to thank you for taking the time for joining me today. We will see you next time.